Good afternoon, everybody. Good afternoon, Virginia. It is 4 o'clock on Monday. We got a lot of news for you today, a lot of good news, but let's first start with the tough circumstances much of our state is facing. As many of you know, heavy rains began falling yesterday, Sunday, February 28th. It followed a week where Kentucky was hit by the last portion of 3 winter storms that left many without power for weeks. The rain plus the melt from the snow and ice has led to widespread flooding. Because of that, last night I declared a state of emergency. As of this afternoon, there are also 36 local disaster declarations that have been declared. They include 29 counties and 7 cities. On Monday morning, tributaries of the Kentucky River reached major flood stages. Also, Monday morning, State Emergency Operations Center activated to level 3, partial on Monday morning. Flood watches remain in effect through 7 p.m. Eastern Standard Time tonight, March the 1st. In response, the Kentucky National Guard has been activated. Approximately 7 guardsmen and women have been providing support to counties like Callaway, Barron, Laurel, Rockcastle, Johnson, and Pike. We have at least 4 helicopters that are helping in the effort, 2 Lakota and 2 Blackhawks. We're assisting with the transport of civilians impacted by flooding to shelters, working on debris removal from roadways and rescue missions. And while the Guard is there, it's our local emergency management that is once again doing an incredible job protecting the people in their areas, and an incredible job in at least one instance protecting our vaccine supply. I want to show a picture of Kentucky Health Department leaders once again rising to the challenge. Last night's weather flooded the Lee County Health Department, causing the power to go out and jeopardizing the COVID-19 vaccine being stored there. We keep going. I know there we go. Thankfully, the Kentucky River District Director, Scott Lockard, and his incredible team, along with, and I think this is the Lee County Emergency Management, conducted a water rescue to ensure that their supply of vaccine was safe. They moved this to Wolfe County because the generators were taking on water. Listen, these folks lost a number of vehicles this day, but they did not lose 1 dose of vaccine. These are what our incredible emergency management and health department employees work on every day, and they are local heroes, and he's even wearing his mask. We appreciate that. To give us more information on what we are facing and its significant scope, we have Michael Dossett, the head of emergency management here in Kentucky. Michael.
Thank you, Governor, and I'd like to echo the governor's comments. Our first responders have been in harness, literally saving lives for the last 48, 72 hours. They have been working throughout the entire weekend affecting rescues. So those that are living in Kentucky and those that are familiar with our weather, flooding is no stranger to us. We flood 12 months a year. Many times they're localized. On some occasions, we reach significant levels. On this occasion, we have set records. We've set records for the number of counties involved. We've set records for the level of precipitation, the amount of rainfall in a short period of time. So the first slide I'd like to feature shows the average rainfall. And if you can look at the 3 darkest colored counties there, that's Laurel at 3.6 inches, Clay at 6.2 inches, and Owsley at 6 inches. And you can see that these have sustained the highest levels throughout this period. So in addition to having the historic rainfall, we have those counties received in excess of 6 flash flooding across all of our tributaries. Should peak today. We have most of the peak. We have one in particular in Owsley County that just peaked probably 30 minutes ago, above their record flood stage. So the other points that we have are the assistance that we've received throughout this event. In the next few days, you'll still see guardsmen out working. As the governor indicated, there are more than 70 on duty right now, and we have a large number of equipment out in the field. We have 23 high axle vehicles, 4 rotorcraft, dump trucks, and backhoes for removing debris and assisting our counties. We have units on duty in a number of counties. The declarations are still coming in. We expect this to be one of the largest flash flooding events that we've had. We have 4 shelters open and a warming center. Swiftwater rescue teams across the Commonwealth from west to east have affected at least rescues in 42 counties. That is a large number for one of these flooding events. So as the water recedes today, we're still looking at emergency route clearing. And if we could look at the last map there, you'll see as the swath cut very similar path across the Commonwealth as the ice storm did. You're now looking at down in the west, Murray at 5.8 inches of rain, Grayson 4.6, Tompkinsville 6.3, Campbellsville 5.4, Richmond at 5 inches plus, Jackson all the way up through West Liberty at 5 inches. So this is something that has taken a large toll. Hats off to all of our emergency responders and to all of our citizens whose stories are being told. It is neighbors helping neighbors, families helping families. So with that, we'll recover. The one point that I'd like to stress is, as the governor indicated, we're just barely recovering from a 3-event storm. We actually had to postpone the damage assessments for the ice storm and notify FEMA that we'll be doing those next week because we're impacted by this flooding event. But we'll get through that and we'll keep you updated. Thank you, Governor.
Thank you to Director Dossett. Tomorrow morning, very early, I'm going to be in Callaway County, seeing the damage there, one of the hardest hit counties, with local officials. Have an opportunity to thank them firsthand for the work they're doing, and of course pledge our assistance to them and everyone else across the Commonwealth to dig out of this. We are resilient. This is just another thing Mother Nature has thrown at us. And it's hard, but we'll make it. All right, let's switch to some really good news in our fight against COVID. The FDA has authorized emergency usage of a 3rd vaccine that is highly effective. That is another victory and a closer step to winning this war against COVID-19. The Johnson & Johnson vaccine is one more tool to help us defeat this virus and to save lives. Like the other vaccines, it protects, almost eliminates severe disease and the possibility of death. In Kentucky, we will receive 36,500 initial doses of Johnson & Johnson. Remember, this is a 1-dose vaccine. That's an additional 36,500 people that we're going to be able to vaccinate over the next 7 or so days. This includes doses going to local health departments and independent pharmacies. More than 130 independent pharmacies throughout the Commonwealth are going to be receiving Johnson & Johnson doses because we know exactly how trusted they are in their community. We're excited about bringing these new independent pharmacies online and expanding options all over the Commonwealth. And here to talk about the excitement from our independent pharmacies, but also the critical role they serve and how they've been preparing for this the entire time, is David Figg, who owns and runs Rice Pharmacy in Ohio County.
On behalf of the small business community independent pharmacies, we just want to say thank you. We appreciate your leadership and appreciate you recognizing the important role that independent pharmacy plays in the healthcare system. And we also appreciate your trust in the administration of this vaccine. Independent pharmacy has been there throughout this pandemic. We've been preparing for months and eager to play a part in putting this pandemic to end. Your independent pharmacies are always there to serve and provide for the communities we work in, the communities we live in, the communities where we go to church. And this vaccine in our pharmacies is another way to ensure access to all corners of the state, even those that may struggle with transportation. We are committed to making sure that every dose is utilized. And this Johnson & Johnson vaccine is a great third vaccine in our arsenal. It's got incredible efficacy, keeping people out of the hospital, and extremely convenient with only one shot needed. This is an exciting time. It's an exciting opportunity. And again, we appreciate you, Governor Beshear, Secretary Gray, and the entire team at the Department of Public Health. We will not let you or the Commonwealth down. Thank you.
We know our independent pharmacies are going to do an incredible job, reach people that are hard to reach, have the trust of their customers. We are excited that more of them are now a part of the family. Team Kentucky that's getting these vaccines out in safe and effective ways. Another piece of good news is that nurses at Kentucky State Veterans Home can receive up to $40,000 now over 4 years to pay off their student loans. The Kentucky Department for Veterans Affairs staff have been working for several years to design and establish this program, which utilizes grants from the U.S. Department of Veterans Affairs. There is a nationwide shortage of nurses, and that shortage is especially acute in Kentucky. Private hospitals throughout the Commonwealth, but especially in Louisville and Lexington, have been paying bonuses to recruit and retain nurses. State agencies like KDVA cannot pay bonuses under state law, and therefore need something different to compete to make sure that we all have the nursing staff that we need. The tuition reimbursement is a creative solution to this problem. I congratulate KDVA and especially their nursing home staff and administration for not giving up and for finding a solution that works in the framework of state government and will give our veterans nursing home the staff that they need that can provide great service to those that have served our country. All right, one last quick piece of news is the Eviction Relief Fund that we have. Remember, Lexington and Louisville have their own. The rest of the state, it's about $220 million. Folks, there's a lot more of it out there. Thus far, we have 5,970 tenants that have applied, 3,673 landlords. Total amount requested thus far, and remember, this is rent and utilities, is only $11.36 million. So that's 200 plus million that is out there to help you pay back and forward rent, to help our utilities and their customers to make sure nobody's utilities get turned off. That is money that is waiting there to help people get through this pandemic and not come out of it with a lot of debt. So please look it up. Make sure you apply to it. We're going to keep talking about it every day. All right. Now we're going to talk directly on COVID and only on COVID. And today is going to be the most optimistic report I've been able to give you. The most optimistic report I've been able to give you since the very beginning of this pandemic. As we sit here today, we have more good news than at any time in this pandemic. We have now experienced 7 weeks of declining cases, if we can put up the chart. This is significant. As you know, we've experienced 3 major waves of this virus. And after the first wave last spring and the second wave in the summer, we acted quickly and aggressively. But when you look at it, pretty much the most we were ever able to do is to plateau the virus, is to stop the exponential escalation and plateau it. Previously, we'd only experienced 3 weeks of consecutive decline in cases, and the decline wasn't as significant. This last week, being lower than the week before, is also hugely significant. So 2 weeks ago, so the second bar from the right in this chart was some of the lowest amounts of tests and testing that we have had in 5-6 months because of the weather. This last week was closer to normal. Tens of thousands, more than that, of additional tests compared to the week before, yet still we had fewer cases. In other words, when you look at that chart, the second to last bar, I think probably ought to have been a little bit higher, though it would have still been a decline. This week is even lower than that depressed value. That shows very clearly we are on a downward trajectory. From our high point on January the 12th, our cases have now fallen 72% over the 7 weeks. Highest daily average of new cases, again, January 12th, 3,985. That was a 7-day average. Wait until you hear the number of cases we have today. Second piece of good news is that our positivity rate is trending downward as well, falling nearly each week from a high of 12% to just 5% yesterday. And I'll let you in, we're under 5% today. These are numbers we haven't seen in months and months and months and months and months. The third piece of good news involves our healthcare capacity. We can show COVID inpatient census, our hospitalizations continue to drop. Our ICU admittance continues to drop. And those needing a ventilator because of COVID have either decreased or stabilized. And we currently have capacity to help people who are sick all across Kentucky. Think about the number of times from the very beginning when there was so much that wasn't known, and nationwide we stopped elective procedures, to our worries, especially in the winter when other hospitals were being overrun. We never reached that point in Kentucky, and where we are today is with sufficient and even significant capacity to help those who are suffering from COVID. Fourth piece of good news is we now have 3 highly effective vaccines, and that supply is increasing. The approval of Johnson & Johnson, the one-shot highly effective vaccine, adds to the growing weekly supply available to Kentucky that has risen in just over a month from about 53 or 57,000 to over 100,000 first doses a week, and that is growing. We'll show you a little bit of what that means in a second. The fifth piece of good news is that we and every other state, because everybody's got to succeed in this, are getting better and better and more efficient at quickly vaccinating Kentuckians and Americans. Our vaccine week runs, if we can show chart 2 of vaccines, Tuesday through Mondays, because we typically receive the vaccine on Tuesday, which means we can't put it in people's arms until really Wednesday. Every week since January, we have hit our goal. We've exceeded it of more than 90% of what we get that week going in people's arms. We've been over 100% every week since January the 5th. This week, which we still have one more day based on what this data is on, if you look down there at the one that is in brighter blue, we've already set a record vaccinating over 100,000 Kentuckians. More than 100,000 Kentuckians got their first shot of hope in just the last 6 days. Remember, this is a test of our system this week, because we actually got more vaccine than we'll have in this next week, even with J&J coming, because of the weather delays. And so we're not only going to set a record this week, one we hope to shatter later, but we're also we're learning a lot. We're learning a lot about how we take more and more vaccine and get into people's arms. It's going to better prepare us for what we are going to see coming forward, which is even more exciting. Can we go to the other chart? As of today, we have vaccinated just under 700,000 Kentuckians. That's 16% of the total population, and over 20% of the population eligible because of age that can receive these vaccines. In other words, that the vaccines are approved for. All right. Are you ready for this? Because it's great news. Because of increasing supply, we believe we're going to double the number of people vaccinated to date over the next month. We believe we're going to have over 700,000 first doses coming into Kentucky over the next month to get in people's arms. How exciting is that for everything we've done from when they started trickling out on December 15th up until the end of February, we may be able to double in the month of March, or just barely moving into April. And we're hoping in April, it'll pick up even more, because this week we're going to get a bunch of Johnson & Johnson in, about 36,000 doses. And that's what had been pre-manufactured. So now they're manufacturing. It has to ramp up, which means the weeks after this week are going to be a little lower on Johnson & Johnson. But then they are going to elevate significantly. And so we believe, especially after, we hope 700,000 people vaccinated in March, that we can do even better in April. Remember, they're going to be vaccinated, through 5 programs we've had to date, 4 of which are going to continue, 1 of which is substantially complete. Those are our state program. That's what most people will get vaccinated from. It's the federal direct program, which is the VA and the Department of Defense. It's the federal pharmacy program, which are Walgreens and a group of independent pharmacies under the Good Neighbor. Then it's the qualified community health centers, and our long-term care program, which we have just wrapped up, and we are already seeing the impact it's having on preventing death in our long-term care facilities. To talk about that program wrapping up, we have Adam Mather from CHFS. I think we have Adam Mather from CHFS. Here he comes.
Thank you, Governor. I'm excited to announce the first doses have been administered for the federal long-term care program for those who wanted them. So that part of the program is complete. Walgreens and CVS are currently working to finish the last few third-round clinics, and those are cleanup clinics. We are now moving into a maintenance phase for continued vaccination in long-term care facilities. And over the course of this week, institutional long-term care facilities or pharmacies that have enrolled in both the state and federal systems will receive shipments of vaccine to administer to long-term care facilities. We are currently working to enroll the remaining pharmacies with the goal of adding them to the program by the next week's state allocation. This program ensures that new residents, new staff, and reluctant residents and staff will be able to be vaccinated. We're truly appreciative to move into this new facet of the vaccine efforts. And with that, I will turn it back over to you, Governor. Thank you.
Thank you to Adam. That is good news that program using federal partners has now provided both first and second doses to just about everybody, with just a few cleanup clinics to go, but also showing that we are being intentional in protecting those most at risk, ensuring new residents and new staff have the opportunity as we move forward. All right, let's look at our demographics, which we do each Monday. I want to start with age. In age, we see that we have been prioritizing those that are most likely to have the worst impacts, most likely to die from the coronavirus. 40% of all vaccines have gone to those 70 and older, and 70% of them have gone to individuals 50 and older. Given some of the CDC priorities on profession, healthcare, first responders, educators, you can see why all of those numbers aren't on the higher end. We now believe that at least half of Kentuckians 70 and older have received at least one shot of hope, and we are continuing to prioritize on them. Just because we open 1C, which we did today, doesn't mean that we don't have specific groups out there that are prioritizing those 70 and older. That will always be our main priority until we get that group, or everyone willing, fully vaccinated. And this is what we want to see in this chart. Obviously, it'll change a little bit over time because there are more Kentuckians under 70 than older. But if we think in the future, when we look at these as percentages, we want to make sure that we see what we see here. Let's look at gender. 62% of shots to date have gone to women. 38% have gone to men. This will level out, but we need to watch as we move forward to see if there's an enthusiasm gap that breaks down in terms of gender. We'll wait and see. Ethnicity, 1% Hispanic, 99% non-Hispanic. We are continuing to work on issues of vaccine hesitancy and accessibility on a daily basis. Race. The racial data seems some improvement, but not nearly enough. Looking at this breakdown, it's 87% white, 4.69% black, which is up just a hair, not enough. 1% Asian, 7% other. We are still trying to drill down on the other. The 80% number for white matches up with population. The Asian statistic is close. Other as a category is way up from what we have for the normal population. We need to understand what that means. But equity programs are in place every single day. Our commitment is to be intentional every single day, and we are blessed that we have leaders in these communities where we need to do better to address programmatic issues, societal issues, and historic mistreatment when it comes to vaccines. We have so many of them, so many of these leaders speaking out. And I believe with their leadership, we will see this improve and improve and improve, because it's not just a value, it's a requirement in how we are going to distribute this vaccine. So when we look at all of the vaccinations going up, when we see cases going down, when we see new vaccines being here, when we see the positivity rate going down, when we see the number of Kentuckians hospitalized or in the ICU or on a ventilator due to COVID going down, because of all that and the strong compliance we've seen lately to COVID rules and restrictions, we're going to provide some incremental but important relief to many businesses and Kentuckians. Beginning on Friday, we're going to be raising capacity limits for several sectors by 10%. This is an initial step where we'll watch and see to ensure we don't see a corresponding increase in cases or these dangerous variants changing what we've been seeing in our trends. The sectors that'll be seeing a 10% increase in allowable capacity include indoor auctions, barbershops, salons, cosmetology, bars and restaurants, bowling alleys, indoor educational and cultural activities, fitness centers, but be careful about group classes and wear your mask. There's some CDC studies out specifically on gyms right now. Wearing your mask is critical, especially in group classes. 10% increase applies to funeral and memorial services, government offices and agencies, massage therapy, movie theaters, nail salons, office-based businesses. The next one, places of worship, capacity is just a recommendation, but the recommendation is going to increase by 10%. Retail, tanning salons, tattoo parlors, vehicle and vessel dealerships, and venues and event spaces. This 10% increase is an increase on the current limitations that have been in place. Still mask mandates in place, and the increase is only allowed if you can achieve it while still maintaining that 6 feet of social distance. In other words, if your facility is of a size where at 50% you cannot maintain social distance, the 10% doesn't allow you to cut down on that social distance. It's having to meet the mask mandate, meet the social distancing requirements, and then the capacity requirement works. Second piece, we intend to increase childcare capacity to regular group size on March the 15th. It's delayed a couple of weeks to give extra time for those individuals to get vaccinated. They were open to 1B, and we want to give just a couple more weeks to try to get as many people vaccinated as possible. I know that is relief to a lot of families that need those additional childcare services. But let's remember, we need to be flexible. With more aggressive variants out there, which are expected to become the dominant strains, we cannot stop masking. We cannot stop doing the things that we know that tamps down this virus. If we do and the cases go up, we have to be prepared to take the opposite step that we are taking today, and I won't be hesitant about doing so. That's just where we are with this virus, and knowing that we are so close to defeating it, making sure we are flexible enough to protect one another, to be able to let some air out of the balloon when we're doing well, but also to be prepared to react if things get tough. And things are still at a place where we were worried about in the summer. So don't let our guard down. Best way to prevent any of that from happening is mask up. So that's a lot of good news. But we cannot forget, and we cannot distract ourselves during some good news and some good trends from the tragic loss that we have and are going to continue to experience in this pandemic. Now, we are at war, and we have lost so much. At least, as we look at it, 600 plus Kentuckians. And I say at least because I think it's going to take us a decade to understand the full loss, whether that is loss of life or long-term health implications that may take people from us at a later time. But I'm committed to honoring all of those who have been lost and making sure that every single one of them is counted now and into the future. We can have no unknown loss and no unknown soldiers. We've watched while states like Ohio and Indiana have recently engaged in audits using death certificates and matching them to reported deaths to ensure that everyone who has been lost to this dreaded disease is counted. We in Kentucky must do the same. We performed this audit in real time until cases skyrocketed in November. Recently, we learned those who regularly perform this function fell behind and stopped doing some of those checks. Instead, they relied solely on reports from local health departments, something the state is fully caught up in terms of what has been reported to us. But this audit that we're going to be performing, that we are performing now, is something we're starting to see in every state. I've seen at least 5. It's the right thing to do. Everybody matters. And it's important that we count every soul that has been lost, and knowing that there is a grieving family behind it. So we're taking a deep dive. We're going to be comparing every death certificate that lists COVID as a cause to our database to see if we can match it up with a reported death. If not, we're going to be looking at whether we can tie it to a positive COVID test. We'll then take each through the same rigorous process that we normally employ for cases and deaths from local health departments. So going through this process, which we have seen in other states, it's going to undoubtedly increase our death toll. But I continue to believe it's the right thing to do. Making sure that we honor those families. And whether it impacts where we fall on how many we've lost versus others, it's nearly as important as doing the right things by each and every one of our families, and making sure that when we are through what has been a hellish year, where we got a lot of people that we'll never see again, that the true magnitude of the tragedy is understood. So we'll have more updates as we move forward. It's too premature to begin sharing any approximations, but we're going to make sure that we get this right. It's nothing less than those grieving families deserve. All right, today's COVID update is some of the best news and cases we've had in a long time. 509 new positive cases of COVID-19. That's the least we've had since September the 28th. Our positivity rate has fallen to 4.84%, the lowest since October 18th. We only have 25 red counties as we sit here today, when for the longest time we had 120 week after week after week. Our hospitalizations, ICUs, and ventilators are all down today. Now, we are today announcing the loss of 15 additional Kentuckians. They include a 77-year-old man from Knott, a 72-year-old woman, and a 72-year-old man from Laurel. From Letcher, a 76-year-old woman, an 85-year-old woman, a 91-year-old woman, a 60-year-old man, a 75-year-old man, and a 94-year-old man. From Perry County, 3 individuals, all men ages 52, 56, and 85, and 3 individuals from Whitley County, ages 78, a woman, 39-year-old man, and a 44-year-old man. Again, if there is ever a bright side in deaths when we announce them, it's the decreasing percentage that are long-term care residents, just 1/3 in this report. Long-term care facilities, again, declining number of cases. 20 new residents, 12 new staff, 4 deaths that we can now attribute to long-term care residents added to that total. 2 new facilities having at least 1 new positive test. All right, we've moved pretty quickly today. I know that is a lot of news. We have a number of journalists on that can talk to us further about that. We'll start with Debbie Yetter from the Courier-Journal.
Governor, can you tell me a little bit more about the supplies of the Johnson & Johnson vaccine Kentucky expects to get, and how you foresee distribution of supplies increase?
So the Johnson & Johnson vaccine, we will get probably the largest amount this week that we'll get in the next 2 to 3 weeks. I believe our number is 36,000. Let me get the exact number because I know I have it. 36,500 doses we are getting this week. It's going to a lot of different places, but we have a lot of independent pharmacies across the state that use a couple of wholesalers that will be getting vaccine for the first time, and they'll be getting Johnson and Johnson. We're going to have a lot of local health departments that get it as well, so it'll be a good spread throughout the state. The positive thing is it means 36,500 Kentuckians are going to get fully vaccinated with those shots. And let me just make sure that every Kentuckian knows that I would take any of these 3 vaccines on any day. They all effectively eliminate severe disease and death, and that's what we're going for. If you would have told me a year ago that I could get a shot where you say ain't nobody going to die, we'd have been fully for it from the very first moment. Tom Latek from Kentucky Today.
Good afternoon, Governor. You were good news to a lot of businesses there about increasing the capacity to 60%. What's it going to take to go to the next level, say, I don't know, 75%? And when might that happen if trends continue?
Well, what we'll need to see is, again, continuing trends. We'll need to see that the variants don't change the trend line that we're seeing. We'll need to watch the increased supply of the vaccine and whether or not we hit points where we have concern that hesitancy will slow us down. And so it'll be all those things working together, as well as, do we see an uptick in cases? Again, when we let a little air out of the balloon and increase those capacity restrictions, a lot of it is going to be how well our businesses, but more than that, the individuals that go into those businesses do with it. Are we going to continue to wear masks? Are we going to continue to do the right thing? Or are we going to see some pictures like we've seen outside and inside some establishments where people aren't wearing masks and are basically on top of each other? So if we can do this right, again, we can continue to provide more relief. Let's remember, we're getting so much closer to that light at the end of the tunnel, and we don't want to mess this up before we get there. So we're gonna be incremental. We're going to be careful and deliberate as we move forward. Melissa Patrick from Kentucky Health News.
Hi, Governor. So there's been a recent outbreak in our Western Kentucky Correctional Complex in Lyon County, and that prompts me to ask again about the plan to vaccinate inmates who are 70 and older. Last time I asked, you said it was your hope to include them with 1C. Has that hope turned into a reality yet.
So we just opened 1C today, but we are going to move ahead and vaccinate those state prisoners that are 70 and older at this point. I don't think the program's been set up in the first week for 1C. If I remember right, we have about 170 individuals that fall into that, and they're not all in the same facilities. So we've got to coordinate getting those doses out. But these are individuals 70 and up that are highly susceptible to this and in a congregate setting. Stu Johnson from WEKU.
Yes, good afternoon, Governor, and thank you. You have mentioned several times this afternoon about the variants out there, coronavirus variants. How confident are you that the decline that we're seeing will continue, or could there very well be an uptick related to the variants?
It's a good question, and part of it is we'll have to wait and see the data as it comes in. But this week being lower than last week, or last week being lower than the week before, certainly instills confidence because there is a lot more testing from this last week than the week before. It shows us that the trend is continuing, and the variants are out there. The variants may become a bigger and bigger portion and be more aggressive, but we know we've got more than 4 or 5 cases of these variants, and so I think we're still waiting to see what an impact they will have, but we're going to be watching closely. But what we know is if you were wearing your mask, if you were doing it right, if you were still engaged in social distancing, we can push back on a variant too. And we believe that these vaccines are pretty effective against these variants. Again, if they just eliminate serious illness, that's the way we defeat this virus. But we got to be humble. We got to be humble in what we're facing in this virus, in that if we see changes, we got to be willing to tighten up, just like we're currently loosening up. Ryan Van Velzer from WFPL.
Thank you, Governor. I have a few follow-up questions regarding the death count. I'm a little confused on what your answers were. You're saying, as I recall, the state checks death certificates and positive tests to try and make a confirmation of a death. Did you say that the state stopped doing that in around November and started using local health department data? And then my other questions are, do you think that there has been an undercount? And yeah, I guess we'll start with those two.
Okay, so there were, when we started out, 2 processes. There is the normal process where we get the data in from the health department that there has been a death, and we then confirm that death and that it was because of COVID. That is where we get the vast majority of our information, and that's what you see in just about the daily reports. But what we were separately doing to make sure that we were getting all the deaths from the local health departments and that there weren't deaths that weren't reaching them, is we were looking at every death certificate, which can come in from a separate way through vital statistics. And if it listed COVID as a cause of death, we made sure that that had been reported by a local health department. If not, we looked at it and we would add it to the total. So what we've learned now, and it's very similar to things we've seen in other states, is when we had the crush of cases and deaths, especially in November, we had an individual who stopped checking, despite it was their job, doing the audit of death certificates to local health departments and making sure that we had seen that all of them. That doesn't mean that we hadn't seen everything from local health departments. Those were all coming in. And so because that was stopped in November, we're going all the way back and we're looking at every single one of them. Do I believe it will result in additional deaths that we haven't known about? Yes. Yes, I do. Virtually every state that has done this has found more deaths out there. And when we look at total number of people passing away in Kentucky during this period of time and everywhere else, we see that it has increased, and COVID is going to be the driving factor for that. I think we're going to see every state do this. Some will wait until afterwards. But when I learned that this audit had stopped happening. And I reached out to some other states to see what had occurred there. Yes, we should expect there to be additional deaths. The amount, it's too premature to say. Whether or not these are people that have maybe passed away in their home or other places, we're digging down into. But we do believe that there will be additional deaths, and we're going to report each and every one of them that we can confirm is a COVID death. Piper Hudspeth Blackburn from the Associated Press.
Thanks, Governor. As the state's vaccine program continues to pick up with the Johnson & Johnson vaccine being approved recently and more vaccine supply in general from all of the three that we have, do you think that it will ever be in the cards from how things look right now that the state will need to set up some sort of federal vaccine center? I know that you mentioned in the past that it would need to come with separate supply and not put a burden on the state supply. But I'm just trying to see, as the vaccine program picks up, is the vaccine site distribution going to grow to the point where it will need that extra material and administration for another vaccine center? Or is it just going to be more supply going into that network of local pharmacies, Kroger, Walmart, hospitals, etc.? Thank you.
Well, I think it is certainly a possibility that we will either accept a FEMA site and or additional FEMA personnel, even with projected supply that we'll get. I wouldn't say supply we're getting right now, but as we get new projections of supply and they increase, it may be that our current providers don't have the staff necessary to increase. So we have that possibility available and open. We have a lot of other healthcare providers that are out there that we are currently working with right now that we hope to have some announcements on pretty soon that are ready to step up and provide extra help. We also have some folks that have been helping out the state in other capacities that have the right licensing to provide vaccines, and we may be able to move them over too. So your question brings up a really important point that it's not just the level of vaccine, it's the staffing to provide it. Now, locations, we're going to be in a lot of locations, especially adding the independent pharmacies. But we want to make sure that we can always hit that 90% mark in that first week. And if we have to adjust staffing to do that, we will. Question from WDRB, why doesn't Kentucky have a centralized system to register and sign up for COVID-19 vaccines similar to Indiana's state-run site? Do we consider a centralized system? Are we attempting to develop one? I was actually talking with Governor Holcomb today, and we were comparing challenges with different ways to date we've been going about it. And there are challenges on both sides. I know there are some challenges in Indiana on getting everybody signed up under one site. There's some challenges here in having to go to numerous websites to sign up. But these questions sometimes don't recognize that we do have a centralized site where any Kentuckian can go that can point them to every single provider in their area that is giving these COVID-19 vaccines, every single one. And at least our rationale to date have been that our partners have much more sophisticated IT systems than we do. The state setting up a single site and then having 4 million people try to get on it and it goes down could ultimately undo days and days of vaccine appointments. The concept that one site alone would be charged with scheduling this, and if it had a major error in coding, in the way it assigned zip codes, in any of its reporting, could throw off the whole thing, to me, is a real significant risk at the moment. Leveraging platforms like Walmart and Walgreens and Kroger, right now we believe gives us that extra security that even if one site has a problem, then we have others that mitigate that risk. And let's not forget, even if we had a state site, it would just be for the state-run program. You still have a federal pharmacy program their community health centers and others. So again, yes, there's some advantages with what other states are doing, and from 30,000 feet, they might look attractive, but there are some downsides too. We want everybody to be able to get a vaccine. We're trying to make sure we're making careful decisions to where, again, we don't put every egg in one basket, especially with what we have seen with a number of IT systems in the midst of a pandemic. All right, that is a lot of information today. We're going to be back tomorrow at 4 p.m. We can answer more questions on today and go over information then. Then on Thursday at 4, we're also going to be live. I'll be in Murray and Callaway County again tomorrow, really bright and early, to offer our state's assistance and to personally see the damage to the area by what Director Dossett has described as one of the biggest flash floods we've ever seen. Everybody out there, stay safe, keep masking up. We're going to defeat this thing. Let's make sure we do it right.